Out of the Ordinary Insights, brought to you by Investex Specialist Bank.
Good evening and welcome to Captains of Industry. Now, the next time you're in hospital, I want you to think about who is around you, what they are using. You may not well be aware of it, but it could well be possible that you are in touch with BD. Who's BD? BD is Beckton and Dickinson. They are a company that makes syringes, they make vessels that we use to collect blood and all those kind of things. And tonight, we're going to get an inside story on where they are and what they're doing in Africa. And I'm joined for that conversation by Peter Mehlape. He is General Manager, Eastern Southern Africa at Simply BD. The point I'm making is that when you mention BD, I don't think many people, particularly in our part of the world, immediately recognize who you guys are. Give me a sense. Who are you?
BD is medical technology that is 115 years old, has been around the world healthcare centers for many, many years, as you can see. We present in over 50 countries around the world. But I think back in Africa, sub-Saharan Africa, we in South Africa, in terms of presence and offices in Zambia, Nairobi, Kenya, East Africa, and Ghana in West Africa, to have a good field coverage of the sub-Saharan market. Yeah. Our technology basically ranges from new drug discovery to drug delivery. So in between, we've got a range of technologies and devices, including devices for sample and blood collections. You probably have been in the hospital for a checkup lately, and our products are touching so many people around the world and in this country as well.
How big a market is it?
The healthcare market is quite big.
It is huge, yeah. Lives and livelihoods, that's quite a lot.
Yeah, and if you look at, Africa has got a huge disease burden. And, although it's about 13% population of the world, but disease burden is 44%. So you can imagine
it's a big market for
how big that is. So maybe I should move forward to say that's how we are who we are. We work the way we work. First is BD just strive into collaborations and partnerships.
I don't think you should be embarrassed because you're a little bit like us journalists. You know how it is. Disaster is good for us still because we get better headlines. And I'm sorry to say, the more people who are in trouble, the better our headlines and the stories and that we have to carry. So necessarily, the higher the burden of disease, the greater relevance for people like you guys. But let's talk about what you are doing in Africa. In terms of market share, how big are you?
We are, sales-wise, just, over R1 billion of sales across sub-Saharan market. In terms of areas where we play, we bring in solutions for healthcare safety protection. The biggest asset in the healthcare space is healthcare workers. Right. With so many infectious diseases.
So you protect the doctors, the nurses, those guys who actually work with patients.
That's right. You know that the prevalence of HIV/AIDS is quite high. Hepatitis B is quite high. What the company has done, from the beginning has been very innovative in bringing in devices and technologies that protect needle stick injuries for healthcare workers so that when they're caring for the patients, for the people, they're not getting infected. So those devices are making a big difference in making sure that the very valuable resources, healthcare workers, are protected and saved for generations.
Yeah. Who are your customers?
Our products touches somebody from a big center like this one up to really the last post of healthcare. Right. Somebody, I can tell you, we've personally been to places where there's no address and our products are there. But people live there, they need healthcare, they need service in our products. I was often in a bus ride to Mbeya in Tanzania.
Bus ride, you say?
Bus ride to 12 hours. They give you one Coke all the ride. 12 hours to a center in Mbeya where, our technology was in. We're making sure that our technology is well installed,
Yeah.
well established, well supported. Because the biggest thing that we do as a company is we make sure that we localize expertise.
Right.
We're an American company,
Yeah.
but as we get in countries, we make sure that you can get the same level of support, technical support,
Yeah.
or application support that you get in Western Europe or US.
Yeah, we're going to talk about that. Let's talk about just how big a market is Africa for you. Now, you gave me two figures. You said Africa is, of course, 13% of the world's population, which we know, but the disease burden, you're saying, is 44%, which, of course, is much, much higher. So there's a high incidence of disease in Africa than in other parts of the world, which, of course, means big business for you. Give me a sense, going forward, what are your plans? Where are you setting up? And the other question I was going to bring up to you is, are we likely to see plans from your company going forward?
I think first thing first, Africa as a market, we're talking number of people, give or take 1 billion people.
Yeah.
But when we talk about the disease burden of non-communicable diseases,
Right.
I mentioned the communicable diseases like HIV, hepatitis B, TB, which is still very, very big in the continent. But then, Africa growth and the quality of life and standard is improving year by year. And as that is happening, we're seeing the non-communicable diseases, your cancers, your diabetes, your blood, hypertension coming in. So our focus is not so much only about non-communicable diseases, we're also focusing on non-communicable diseases,
Right.
like your cancers,
Yeah.
your diabetes,
Sure.
the more lifestyle diseases,
Yeah.
where it's becoming a burden.
Right.
I mean, for instance, we see that a number of people suffering from non-communicable diseases like your cancers, your diabetes, hypertension,
Yeah.
they die unnecessarily. Those diseases are addressable through treatment, through interventions. They shouldn't be dying that way. For instance, the area that where we're involved with cancer is more on education and awareness.
Right.
Making sure that people are aware about these diseases. They get screened regularly because if you are having some sort of a cancer, you get screened
Yeah.
and detected much more earlier. Treatment can be given or surgery can be done, intervention can be done,
Yeah.
and you can, live long.
Yeah. So give me some figures, Peter. We're sitting around, you said around 1 billion now. 2, 3, 4, 5 years down the line, what are we looking at and where?
Probably, populations, grow differently per country. This country is projected to grow 0.7% year on year. But West Africa, East Africa, they're growing at probably 2-3% year on year.
Sure.
So you're probably looking at a population of Africa becoming 1.5 billion
Right.
in the next 10 years.
But in terms
which
of
is
your revenue now, what would you be looking at?
it's going to be driven by these areas that we're focusing
Right.
and looking at over 2 billion.
Okay.
Yes.
So let's talk about those areas that you're focusing on. What are you looking at?
Remember I told you about being to places where there's no address.
Yeah.
I think as a company, we see that those people need care.
Right.
And our R&D is working tirelessly behind the scene to make sure that we're relevant. By relevant, I mean we bring technologies that can service healthcare worker in the last mile of healthcare.
Yeah.
And we've done research about 3 years ago around the world. We went to 30 countries to find out what does a doctor need to function optimally? What does a nurse need to function optimally? They told us what they wanted. They wanted diagnostic tools that are very simple, easy to use. In some cases, they don't rely on electricity. That can provide simple answers. They want to know yes or no. Does this person have cancer or no cancer?
Yeah.
They're
Yeah,
not
that's
interested
simple.
into a lot of details.
No, I think we can relate that even to your
Yeah.
personal level. I'd really would rather just walk in and be told, yeah, you know what, you have it, you don't have it.
Exactly.
Yeah.
So our R&D's worked hard to
How
bring
far are we, do you think, from that kind of a scenario?
some of those products are available in the market. We've got devices that are battery operated that do not just rely on the electricity. But, you know, in that setting, that last mile of healthcare, where the infrastructure is very limited,
Yeah.
is, you know, remember, you know, think about the man in the street, in that dusty street. You know, they're looking for solutions. Sometimes
Yeah.
to get to a clinic, they walk 3 kilometers.
Yeah.
They have a
Yeah.
2-kilometer ride off a bus.
Yeah,
If
yeah.
they get to a healthcare center, they need some answers immediately. They don't
Yeah.
want to be told,
Yeah.
I'll take your blood, come back next week. They may not have the time,
Yeah.
and the money to pay for the transport
Yeah.
to come back.
Look, it's something I definitely understand, and I've seen it in operation. I can't talk personally, but it's certainly something that I've experienced myself.
So the other thing is, you know, also the reality in those places is Western modern companies like us, we're probably competing with other interventions,
Right.
traditional healers.
Yeah,
If
yeah.
you go to a traditional healer,
Yeah,
you know,
you'll get
they
your
tell you
answer, whether
immediately,
it's correct
and they
or
tell-
not.
They tell you what to do, where to go immediately. They're not gonna, you know, do some test that does not
Yeah.
bring the results immediately
True,
to the table.
but you
So
get your answer.
That is the context that
Yeah.
we're dealing in.
Okay, so are we likely to see at some point BD setting up a factory in Africa, or at least a plant, or an R&D center like we saw? I think it was IBM we have set up in West Africa, sorry, in East Africa.
That's very likely. I mean, our commitment to this region is quite big.
Talk to me about that commitment.
Commitment in the sense that we approaching this market in a different way. A conventional company will see a market like South Africa being the core, and everything else is export. The way we commit into this continent is through taking every country, every market as an opportunity that's unique. The opportunity may not be there, but we know that, you know, as countries grow and develop, the opportunity grows. So we team up, we partner, we collaborate with non-governmental organizations, governmental organizations, and all sorts of stakeholders to make things happen. Because as a company, we've known a long time ago that sometimes you cannot do it alone.
No, for sure.
And that commitment is about, at the moment, we've been talking with the government of Ethiopia, trying to set up because for us, Ethiopia is the second populous country in the continent.
True.
With 85 million people, depending on
Plus
who's
or take,
counting.
yeah, absolutely.
So in Ethiopia, it's a very interesting country. It's vibrant, it's developing, it's coming up. If you operate in there, and that government is very serious about making healthcare accessible to people.
You able to give me a commitment in terms of capex that you're reserving for Africa?
There is no capex. The way we work, we don't work on those sorts of budgets as a company.
Yeah.
It's kind of a zero-rate budget.
Right.
You know, if we
What
see
does
an
that
opportunity, what it means is, you know, if you put budgets, you end up putting them in buckets in places where they need it.
Yeah.
What it means is, if we see a need, we allocate resources according to the need.
Okay.
And make sure that
Okay.
is
Okay.
delivered.
Are you going to give me a date by which that plant is going to be in Africa?
The plant is going to be on a need base.
Okay.
You know, basically, I mean, a rule of thumb says if you're manufacturing in a country, the local market needs to be able to be big enough to consume 50% of your capacity. So the demand, more and more people are taking up healthcare. Medical insurance is coming in throughout the continent. As that grows, we're going to, you know, evaluate where the opportunity is much more bigger and chances are there, and take it with time. We're there with our own people in most of these countries. Remember, I gave you 4 sites around the continent. It does not mean that we don't have our own people in Uganda, in Botswana, in Ethiopia, where we may not have the office, but we've got our own people working with healthcare workers there to make sure that our products are being used in the right way and everything goes well.
We're talking to Peter Mehlape, he's General Manager, East and Southern Africa, and he's from BD. He says that plant is coming. When it's coming, we'll keep following up for you and bring that to you when it happens. We're going to take a short commercial break. When we come back, we'll try and see if we can trace Peter's life, how he camp to be involved in this industry, and also perhaps the role that companies like yours can play in South Africa's national health insurance scheme. Don't go away.